All right. Welcome, everybody. Give me 1 second. We're recording and we're live, and we're here with myself, Erin Power. I'm PHCI's Coaching and Curriculum Director. I'm here with Jennifer Sweenie, who is one of our esteemed course authors. She has been tackling for us for many months a very important course that we just released to the world. It's our Functional Lab Testing Specialist Certification course for health coaches. We want to talk about why we thought it was important for this course to come into existence. And we're going to talk today a lot about scope of practice / professional conduct, kind of the same, two different ways of saying the same thing. That's going to be really the emphasis on our conversation today. Those of you watching, feel free to post questions if you have them about the course or about anything you hear us talk about. And we'll try our best to get through the questions, but we have a pretty good agenda ahead of us here. And just so you guys know, we're having slight technical issues.
I'm back. I don't know at what point you guys lost me. I'm having problems starting my video again, though, Erin, if you want to.
Okay. 1 sec.
Sure.
I get you. Boom. We are sorting out technology. This is the world we live in.
And we're back. I know, right? I made a joke earlier. It's like COVID was 4 years ago and we're still dealing with it.
I know. Well, we got comfortable. We got too comfortable with Zoom. Now we're like, oh, it works every time. And then when it doesn't, it's like, oh, I forget how to
exactly.
But you didn't miss anything. I was just telling our audience what we're kind of going to talk about today. So we're going to talk about why we created this course. Want to really pick your brain about that as the course author. And then we're going to really zero in on scope of practice and professional conduct, because that's honestly, gang, one of the big reasons why we felt called to create this course. Oh. Are you with me there, Jen?
I'm with you now. Yes.
Okay. I'm going to throw it over to you, and hopefully our technology flows. Can you introduce yourself? Give us a backstory on you.
Yes, I will. Absolutely. So I'm Jennifer Sweenie. Nice to see everybody. I am a Primal Health Coach, as well as a functional nutritional therapy practitioner, as well as a writer, which is how I came about. I've been blogging for my Primal Coach for a couple of years now. So that's how I came into writing this course. And I was excited, so excited when the idea of this course came up, because I think it's kind of a wild west right now, with this whole lab testing thing. And I'm seeing in the different communities I'm in, especially on Facebook and alumni groups and stuff, so many people are interested in it and they want to use it with their clients, but there's so many unknowns, so many gray areas, so many blurred lines. And I think, Primal Health Coach Institute, of course, is at the forefront and wanted to approach it the right way, approach it the correct way. There really is no technical legal scope yet, which makes it kind of terrifying. And Primal Health Coach is taking the initiative, saying like, let's stay on the right side of what will eventually be a law. As of right now with lab testing, it seems like the regulation has not caught up with innovation and all. I mean, it's like their new test every night. You go to the drugstore now, and there are tests on the shelves. So it hasn't caught up yet, but it will, and we want to be on the right side of things. So I think the course does a really great job at addressing scope, and there's a huge emphasis on scope and how you can utilize lab testing with your clients, because it is like the Wild West. There's so much to be gained from it, and it's so helpful to your client and to you as a practitioner and to doctors in the medical community, the licensed medical professionals. We can help them out there. So it's all about approaching it though in a smart and intelligent way to make sure that we are staying within that scope that is yet to be defined, but will be.
Correct. I think you brought up something so important. I had to write it down immediately as soon as you said it. You said it in such a great way, which is like, there's no regulation right now about what we can or can't do here. And these consumer lab testings are really available to everybody. But first of all, we want to get into this. The way we talk about it is really important. The way health coaches talk about these tests is what is going to make or break whether we are staying within or without our parameters of professional conduct. But what you said, Jennifer, was it will eventually be a law.
Mm-hmm.
It is not regulated now, but it's going to be, like, inevitably. And what we feel as educators, and you really brought this around too, what educators, we feel like we want health coaches to understand now how these laws will probably look based on what we know about health coaching scope of practice as it relates to medical scope of practice and where we fit in there. So we ought to just behave now as we know the regulations will eventually ask us to. And as I said with the Dr. Barry interview we just did last week on the same topic, it's like, we don't need a broader scope of practice. Our scope of practice is awesome. We really get to help people. So we don't have to worry about what we might call a restricted scope. We just have to know what we can and really should do. So I thought that was really, I think it's really important to just know that, gang, right?
Yeah. It's growing. So it's kind of like I'm likening it to AI. It's growing so fast and so much good is going to come of it. But there's also ways that you can do bad things with it right now because it's not defined yet. So it's kind of like we know we're going to catch up and eventually there are going to be rules and regulations around it. So it's about, doing the right thing now, just right from wrong, that type of thing.
Yeah. So just to kind of carry on the origin story, why we made this course, Jennifer kind of touched on this. Primal Health Coach Institute has really been doubling down on, as I said earlier, ensuring that health coaches know where they sit in terms of professional conduct, scope of practice. Now, I'm using those two phrases interchangeably because I guess technically we don't have a scope of practice yet. We will use that phrase because it's sort of the familiar phrase, but until we're more regulated, we don't really have a scope of practice. But I like to refer to it as professional conduct because we're trying to be a profession here. We're trying to all be in the same profession, you, me, all of us. And I want health coaches to think about this first from the perspective of the profession of health coaching. What does the profession need and what does it not need? And one of the things I think it doesn't need is a lot of attention from regulators, a lot of maybe negative attention from regulators who are kind of keeping their eyes peeled for anybody who's operating in a bit of a gray area. So in the course, Jennifer, we have a section of the course, chapter 2, right out the gate, scope of practice.
Yep.
Before we get into this, before we get into any of these tests that we're going to talk about, here's what you can and should do. And we interviewed Daryl Rogers from the Holistic Council, who I think is a really great resource for this. The guy is
Absolutely.
He's our main advocate. He's our main lobbyist. He's got a legal background, so he can really decipher and explain this stuff. What did you learn in interviewing and working with Daryl?
Kind of exactly what you just said. Like one of the first things he says off the bat is there is no scope. Like it's technically not defined legally, but it's about professional conduct. I love how you use that. I think that's the perfect way to look at it. And I learned it's really all about protection. And not just protecting yourself as a health coach,
Yes.
keeping like you said, why raise any flags? Why bring any regulators to us? Let's protect ourself as your liability as a person conducting business. Also protecting your client. You could, if you're doing the wrong thing with lab results, you could really potentially harm your client physically, emotionally, their mental well-being, all of that stuff. And then it's about protecting ultimately, health coaching is a whole profession. We don't want to be that woo-woo, like they don't know what they're doing. They're all crossing the line and doing all these crazy things. It's more about protecting the legitimacy of health coaching as a profession. And, we do know what we're doing and we're staying within our lines. We're staying within our professional conduct and scope.
Yeah. What I learned in reviewing what Daryl shared with us, he's so pragmatic as I would hope anybody in his role would be. But he says these consumer lab tests are amazing. It's amazing that consumers, you, me, all of us, we have access to any test we could possibly want or need if we're willing to track it down and pay for it. It's amazing. It's just an awesome resource that we want our clients to know they have access to. But this is actually a pop quiz for anybody watching live. The thing that makes this a little dicey for health coaches, and I've been talking about this for years and years. So if you've been around for a while, I'm going to ask you, what do you guys think is the most important factor in all this that helps us really stay in our lines? As Jennifer says, what is the one thing that we really need to watch and be careful of to make sure we're staying in our zone of professional conduct? I'm going to give it a 3 second. If anybody watching wants to pop an answer into the chat, because I'm going to answer.
Oh.
Sarah says we don't order or prescribe. Good. Nice. I love that you guys know that. We're like order, prescribe, diagnose, treat. We're not doing that. You guys know that.
Yep.
We don't diagnose with the lab results, Sarah says. So great answer, Sarah. And what the larger piece of this is language. The language we use, you guys, is so critical. So we would never say, let's order this test so we can diagnose, prescribe, treat, or even coach. Like we don't need to order tests in order to start coaching. The language that we use, and this is what Daryl said, this is why I'm bringing this around. He said, the tests are completely benign and we can tell our clients that they exist and we can point our clients to them. There's ways to do that. But as soon as we say order, run, any of this language, now it became a simple consumer product. Now it's a medical product, and we are out of line. And our language changes it like that. Isn't that crazy? Do you want to add to that,
I
Jen?
think yeah, that was a big takeaway too, speaking with Daryl, is that the way there is some regulation, absolutely, with the FTC and FDA, that if you do change your language, then you are opening yourself up to even language you use in your marketing material. Even if someone comments on one of your social media posts and it's under the guise that you diagnosed or treated or analyzed or evaluated, you then open yourself up to laws that do exist. So, like I said, that's the Federal Trade Commission, like marketing, et cetera. So the language, absolutely, you really have to stay away from anything that's like doctor speak, which we shouldn't be doing anyway.
Correct. Right. So one thing Jennifer said that's really important is that the way we talk to our clients is really important. I think that we establish a trusting relationship with our client, and they know what our relationship is about, the coach-client relationship, and the way you language your marketing efforts, anything, a social post, a blog post, anything that's going out there to promote yourself, also critically important. The internal and the external language you use can flag you. That's where, not that you're I don't want you guys to get worried. I'm just here to protect you like the mama bird. You don't have to use that language. Your business does not rely on it. Your practice does not rely on it. And please do protect yourself and the profession by just being really cautious with your language. So what language can we use? This is always a good review. I'm going to open it up to the chat. Throw in the words, the language of health coaching. I've got a few on my list here too. What is the language of health coaching when it comes to things like this? Health-related processes, supplement, anything that exists out in the world that maybe we want to point our client to. What can we say? What words can we use? We can't use diagnose, treat, prescribe, order, run. We can say support, guide. We can offer resources, insights, education. We can offer coaching. My favorite word is support. I love that word.
Mine is educate.
Educate, yeah.
Yeah, I feel like that, yeah. It's empowering the client with, you're providing the knowledge, and then they can make their decisions based off of what you provide them with. Yes. Which is supporting as well.
Heck yeah. The empowerment piece is huge, right? And this is my personal point of view, Jennifer. I'd love for you to weigh in on this too. So we're just gonna kind of speak as health coaches now. Myself as a practicing health coach, never mind the educator piece, the mama bird trying to protect all of her little primal health coaches. But I love my clients to feel empowered inside the bigger health and wellness world. Hey, Sally, my client's name is always Sally, my pretend client. Sally, there's a test you can go and get that will help you understand XYZ, metabolic thing that you're struggling with. Here's a place you can go get it. I really encourage you to go and check that out. And you'll uncover a lot of interesting information there that you can then take to your doctor and have a good conversation with your doctor. And we can come back and have some conversations too about how to execute diet, lifestyle, maybe movement changes that will support, improvements on those markers that you find in the test. How exciting would that be? And so we're helping the clients put the pieces together. I have this data point from a test. I have my health coach helping me execute behavior change. My doctor's helping me understand how to do this too. The client has now empowered themselves to go out and get the information they need, and we can support them in that. And that's amazing.
Absolutely. That's kind of what one of the biggest takeaways working on this course is that if you just view lab testing as not an us versus them, it's like, oh, well, your doctor won't test you for this, so let's have you order it elsewhere. It's more about just additional data, collecting data. So they can go to their annual physical and be like, hey, I have all this extra data for you. Because doctors, let's face it, they don't have time to sit and connect the dots with what might be going on with their patients. They just look at your numbers and maybe say, I'll see you next year. If they're working with you as a health coach and you're educating them and supporting them and maybe suggesting they might want to look at this test, that test, they just go to their annual physical with all this data. Just be like, hey, here, look, what do you think? And it's so much more helpful. It gives the doctor, they could get maybe 5 years ahead of themselves in a diagnosis or something because you have that additional data for them.
Yes. Also, I think even foundational to that is the conversation we can have with our clients. And by the way, I do this all the time, where I'm trying to get a beat on how they're feeling with their relationship with their doctor. Like if the client says, "Oh, my doctor never orders tests like that," then we don't say, "Man, your doctor sucks." We don't say that. We say, oh, well, these tests do exist. So would you be interested in maybe tracking down another doctor that would be more open to exploring these with you? Like that to me feels like in the purview of a health coach. I want people to feel that they can trust their doctors and get what they need from their doctors. That's an empowering move too. Right. So there's a lot of conversations we can have that stay within our professional conduct that help our clients.
I think that's another takeaway from the course is that you realize the client may say, oh, my doctor never orders these tests. Have you asked? Because as a health coach, it might not be that you need a new doctor. It might just be like they weren't aware. Like I think Dr. Barry does a really good job of addressing that in the course. A lot of doctors don't know that these tests exist or that the client has the power to go out and order them on their own. So it could just be a miscommunication or a lack of communication.
Yeah. I'm curious if you were, you're obviously, you're an educated, skilled health coach. You've got a few different certifications. And I'm wondering I'm just curious, if when you were writing the course with Dr. Barry, if anything that any of his points of view on this surprised you?
He changed my mind on food sensitivity testing, completely changed it on that. So that was I think he does a really good job at demystifying the test and then giving the student, whoever is taking this course, kind of client speak and how to, navigate talking to your clients around them. So that's the first thing that comes to mind was the food sensitivity testing. I was just like, oh, the little bell went off. Like, okay, that makes sense. I don't know why I never thought about that before, but that surprised me. As well as some that he just deems, nothing wrong with them, but they may not be useful. And then he'll go in and explain why. And it kind of is eye-opening. It's not saying there's something inherently wrong with that test or that, people ordering it and taking them aren't gaining anything, but it might just be a waste of money because it's not giving a fuller picture or it's not giving a more of the root cause approach.
Yeah, that was what I was surprised about. And I remember years and years ago hearing another functional doctor. This is so long ago, like maybe a decade ago. It's the first time I'd ever heard this point of view, which is why are we having patients, and the doctor talking about patients. So he would use the word patients. We would use the word client. Why are we having health consumers do so many tests? Some of these tests are pointless and some of them are confusing and they're expensive, and now they're getting more and more diagnoses and without any action behind it. And what's the point? This doctor's point of view was we're over testing. And I kind of got a little bit of a vibe from Dr. Barry about that too. I mean, he really zeroes in on a few tests that he thinks are really, really impactful. He mentioned, the comprehensive metabolic panel. He's like, that's where everybody should start.
Yeah.
Yeah. I just had one of those done myself, which I'd never had before. And I had to track down a doctor that was willing to do it. Right. So that again is, okay. We can help our clients advocate for finding a doctor or clinic that will do it. Man, it was incredibly fascinating and like not scary. I wasn't, it's sort of like, this is my personal opinion, but it's like, do our clients need more diagnoses? Do they need to be spooked more and scared more and worried more? Or can we frame this as like, let's get the full information. Let's get the full information and just see what we're working with, like baseline testing, basically.
I also think on that note too, it's also, and continue to get that information because it's like a snapshot in time and your tests aren't definitive, most of them that he talks about in the course. So it's kind of like, all right, if you test this and it happens to be a little bit high, let's just keep an eye on it and maybe retest. And he goes in detail of when to retest and why to retest, et cetera, when to work with the doctor on that. So I think that's also, an important thing to keep in mind too, is it's not just like, oh, this is wrong with you, then this is your diagnosis. Doctor speak, the doctor saying that. It's more of, all right, let's keep an eye on that and watch it and see what's happening here. Again, that whole picture, a snapshot in time of what's actually going on.
Yeah. Well, can I ask you a loaded question, which I didn't?
Sure.
So one of the questions we've been getting from health coaches on this course is, oh, what kinds of labs are you going to teach me to run with my clients? First of all, we've already established that we're not using that language. So the answer is we're not even doing that. If I was the health coach asking you as the author of this course, ooh, what's this going to teach me about lab tests? What would you say?
I would say it's not going to teach you about the black and white, when to do this, when to do that, which I think is what's happened. That's kind of why I refer to the Wild West. I think that's happening with a lot of things out there. Because it's unregulated, there's a lot of room for opportunity. I think it's more about seeing the big picture and then saying this might be helpful to gather more data and have that data to work with your physician on. All of us can work together as a team. Again, it's not that us versus them. So it's not saying, hey, here, run an HTMA and it's going to tell you this, that the person's deficient in that, and then you tell them to eat this and take that supplement. No, 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 no. It's more about, let's get an overall picture of your health, starting with, you mentioned like a comprehensive metabolic panel, and let's build from there and just get that bird's eye view of what's going on with my client and how I, as a health coach, can support them, can educate them, can coach them, as opposed to run this test and I'm going to tell you to do X, Y, and Z, because it's not black and white like that at all. That's where the scope comes into play.
Yeah. I wanted to pull open the curriculum because it's just really great the way we have the chapters broken down. So we start with an introduction to lab testing and data tracking. So by the way, we do talk about things like getting your biometric data from wearables or wherever else we're getting them from. So because this is all data, and I was mentioning this, who was I talking to? I think I was talking to maybe some of my business students, but I'm going to be going to a conference this year and doing a talk about the subjective experience, sort of the subjective experience of health. So we get data, and then it's like, how can we connect this to the lived experience of health? So I'm kind of pushing back on sort of leaning on data too heavily. That's my own personal point of view. But we do talk about how to appropriately use these things, right? We start by also this baseline testing, to your point, like, what is a healthy person? What is a metabolically healthy person? We have to really address the fact that even the normal ranges for most of these tests are kind of based on unhealthy population. So then there's the optimal ranges, right? We in chapter 2 move through scope of practice. Like I said, we talk with Daryl Rogers, and it's a great chapter. I'm never not loving a scope of practice chapter. And then we get into what Dr. Berry considers to be the most important ones. We have the comprehensive metabolic panel, comprehensive lipid panel, thyroid panel, the sex hormone panel. And then we have a chapter on food sensitivity testing where Dr. Berry shares his point of view on it. But the reason I'm going through this little run through the curriculum is because you mentioned like an HTMA test, hair trace mineral analysis. Right. We have things like that, Dutch test. What are the other ones that exist? Like testing saliva, testing
mold testing. Yeah.
Mold testing. Yeah. So a lot of to be really frank with you guys, Dr. Berry's not a real big fan of these. Or not a real big. There's some tests that really deliver interesting, empowering data, and then some that is so confusing. It's probably more confusing than helpful. And he's actually kind of ranked some of those in that category, which I think might be a surprise to a lot of health coaches, because those ones feel like they're more in our wheelhouse, right? Hair, urine, saliva. I don't know why.
Yep, absolutely. GI mapping, all of that stood out to me too. And he does a really good job, again, at demystifying it just in his point of view. And a lot of the times it's just a matter of what it provides, whether or not, maybe the science hasn't caught up yet, that's giving us the ability to do anything with the results, and B, it might just be a waste of money. Ultimately, you're having your client spend $100 on a test that's not really there's not gonna be much to do with it, with the results.
Yeah. Plus the GI map is just not a pleasant experience. Personally, did not enjoy it. What else do you think we should say here, Jennifer, about what students will get out of this course?
I think one of the things that stood out to me working on it was that chapter 1, just the intro. It sounds like just intro. That's the meatiest chapter. Chapter 1 and 2, the intro plus the scope, those are the meatiest. It took me the entire duration of working on the course to get the first chapter concluded, because I had so much to dig through out there, because it's the Wild West of really breaking down the types of testing that are available and how they fall under different umbrellas, whether it's direct to consumer, or the term we use, consumer directed, which is more accurate, because direct to consumer is actually a type of test where you can, go buy an Everlywell kit over the counter and take a blood spot at home, or you can go to a LabCorp or Quest and get blood drawn. Those all fall into different categories, and it kind of funnels the way they're viewed by the FDA as of right now. So I think that the intro chapter is probably much meatier than would be expected, because most intros to any kind of course is just kind of like, here's what we're going to be discussing. This is more of breaking down kind of like, what are these tests? Because you hear about HTMA, you hear about, GI mapping, all of that. And it's really breaking down of how the whole process from decide or knowing what the tests are, to ordering it, to collecting it, to sending it in, to getting the results, how that whole process pans out. Yeah,
I think what I want to share is that there are a lot of tests, or hundreds of tests, right?
Thousands.
Thousands of tests, right? They're not all, I mean, they're not all tremendously useful. They're not all really useful. And if you guys consider, health coaches consider, and I always think through this, like the amount of overwhelm health consumers already feel. I mean, they log into Instagram and they have to see 15 different dietary approaches, 15 different exercise approaches, 15 different talking heads saying do this, don't do that. They're already overwhelmed. And now we're layering on overwhelm of data, much of which might not even be useful in the big picture of their health. What we wanted to do here is not say, look at all these labs that are available for you to, address with your client. It's like, here's the ones that matter. And here's how to actually execute those in a way that protects you, protects the client, protects our profession. And not just protects, but helps. You can really, really help your client with this data as long as you approach it appropriately.
I think another good point kind of Dr. Berry made to that is that there are thousands of tests that you can order and get results from that may be useful, but like you said, use the word overwhelming. It absolutely is overwhelming when it really does come down to the basics first. So it's like, why do you need to know X, Y, and Z? First, get your client eating a primally aligned diet and exercising and getting some sunlight, at noon. And then in a few months from now, if you still see some things going on, maybe a test would be helpful, as opposed to ordering all these tests and spending all this money and getting all these different results about stuff that really just comes back to starting with the basics, which is lifestyle and food.
Absolutely. We have an awesome toolkit to enact big feelings of change. Again, the subjective experience, I'm going to zero in on that, because my point of view is that health coaching clients come to us and patients go to the doctor because they don't feel good. They don't feel well. I don't feel as good as I could. I'm uncomfortable in my skin. I hear this from clients all the time. All the same sound bites. I don't feel like me. Well, let's sort of return to some of the, what we consider the ancestral roots of health, because that's what we do here at Primal Health Coach Institute. We're very ancestral in our approach, but the basics, right? Protein, sunlight, sleep, walking, whatever, anti-inflammatory nutrition, blood sugar balancing, all this good stuff that we love to zero in on. And then it's nice to know that there are next steps the client can take, but those initial steps are in our wheelhouse and massively impactful. And then it's also, we just want you all to know and know how to effectively use the next steps, should they be an important part of your client relationships. So we want health coaches to feel successful. And I think the way to feel successful as a health coach is to have clients who get great results and feel amazing about their outcomes with you, ultimately. And I was telling my business students this, what our clients really want in some cases is the quick win. How can I start to feel better sooner rather than later? Yes. And going through a bunch of tests, that's not going to do it for them. Yes. So what we can do to make them feel better immediately and to feel again empowered and supported is that's what we get to do. I feel really lucky about that.
And I mean, like kind of your point, I find, just asked by friends and clients, everyone always kind of wants an easy button. And unfortunately, there isn't one. And it's about getting down to those basics, like you just said. So, it's just adding the overwhelm when there's really no need to, and there's no, reason to do that to your client.
Exactly. I agree. They're already overwhelmed enough.
Exactly.
Well, we covered a good amount of ground. I feel like we covered a good amount of ground here. Jennifer, is there anything you think lingering that we should help these folks know before they decide to join us?
Not off the top of my head. I think how I viewed it, my biggest takeaway in terms of scope, in terms of, the topic of this webinar, was that, like I said, it's the Wild West. The regulation will come, and it's kind of about being on the right side of a law that doesn't exist. And I think instead of viewing it as an opportunity or to capitalize on it, it should be more of like pressing pause and saying, all right, how do we utilize this with our client's best interests and our profession's best interests at heart? As opposed to like, wow, this is so cool. I can order thousands of tests and spend all this money and give my client all this information that's going to make me look really good. But it really comes down to what's kind of the right thing to do. So it's kind of like tapping the brakes and saying, wow, we are looking at the Wild West. And before we go like start digging for gold, like what are we going to do? Because a lot of bad things can come from that. Yeah, that makes sense.
It does. It does make sense. I think about some health coaches that I see that I might follow on Instagram or whatever, which who are, sweating over these lab tests they got back. And it's like, why? Why? You don't have to do that. But I also don't want health coaches to feel limited, because I feel like there's no limit to my scope of practice, quote unquote. And the things we get to do are the things that really help people to feel better and feel empowered. Feel better and feel empowered. Feel better in their bodies, feel empowered with the health and wellness and medical industries, which is a very disempowering industry, quite frankly. And the wellness industry, the fitness industry, which I've been in for 30 years, it's a pretty disempowering little industry. And we have the chance to kind of bolster our clients' feelings of empowerment. And so there's this isn't putting limits. This isn't putting limits on health coaches. It's just, we just really want to encourage you to know that the things that live within your professional conduct are massively, massively important things. And we can help our clients at this next level as well. There's a way to do that without overwhelming yourself, overwhelming your clients, and running the risk of putting our industry under the microscope unnecessarily. So that's our big point of view on this.
Yeah. And I just quickly want to add too, I think it's really refreshing to have Dr. Berry, who is a primarily aligned physician, though, seeing it as, wow, I want all you health coaches doing this. This is fabulous. Let's all work together, because ultimately the patient, our client is going to be the one that benefits. So it's, it's kind of like you said, it's not limiting, it's more expansion, but let's do it in the way that's responsible and that everyone's going to benefit from.
Yeah. Boom. Well, we agree. Jennifer and I agree. Hopefully you guys agree. We would love to know what you think about this. And of course, we'd love to have you join us in our functional lab testing. Sorry, I'm getting my course names mixed up. Functional lab testing for health coaches course. It's going to teach you how to do this. It's not going to teach you how to run a bunch of tests, because we don't do that. It's going to teach you how to do everything we talked about here, feeling really good about how you're helping your clients, feeling really good about your professional conduct and your scope of practice. And that's what matters. Okay. So thank you for joining. Oh,
I just quickly wanted to add to what it does. I think the course does a good job too, is that, when you do get these lab results back, there is without interpreting, without overstepping your boundaries, there's absolutely a way to guide your client. We go into case studies of, let's say the lab results come back with this is what you can suggest they go speak to their physician about, or here's another test that may be helpful, or maybe keep an eye on it, et cetera. So we do go into what you can do as a health coach with those results without overstepping your boundaries and with staying, within professional conduct.
I'm so glad you brought that up, because I was going to gloss over that.
I know, like, one more thing.
Yes, we this is not just theory. We do teach you how to practically apply this. Also, there's a big pile of resources as well. Trusted lab partners and further resources, ones that Dr. Berry thinks are really, really worth pointing your client toward, that are really well supported by doctors, and that give information that can really help you to help them. So I just want you all to know there's a ton of practical applicable stuff in this course too, that you're gonna be able to take away and work with your clients. And this whole idea of the rising tide lifting all boats. Health coaching is such an important part of the health and wellness and medical world. It's becoming more important in the medical world as well. And we get to do this. We get to be health coaches. Okay. So that's all I've got. Unless you have any more last little sprinkles you want to throw in there.
I do. Just the resources, like you said, we do have some labs that we suggest, and what they do, which I think we're going to see a lot more of happening, is that instead of just providing raw data to your client and to you that you should not be interpreting, they have physicians on staff or in-house that are giving a packet of results that are interpreted by that physician, that the client can read through, that you can read through, that they can go to their regular physician with. So it's not like the Wild West in terms of what's out there with these labs. You are getting actual physician interpreted results that we have samples of those that you can look through.
That's right. Yeah, one a good example, and an organization we've been really aligned with for a long time is Precision Health Reports, and they do this. What do they call it? It's like a metabolic panel kind of thing. It's a metabolic risk assessment, and so it gives you, it'll spit out this report that shows different blood values, but most importantly, it says here's what to do. Here's how to support yourself to improve these markers. And that's the stuff we can run with. So like, imagine your client comes to you with this packet and says, well, the lab values say this, and you can flip ahead to 3 pages and say, well, actually, and the report tells you should be maybe consuming fewer carbohydrates or whatever, getting sleep or whatever it might be. And that's what you can execute on. That's what's going to move the dial for these people, for these beautiful clients of ours. Yeah. So so the lab partners section of the course, really useful because this has been really vetted by Jennifer and Dr. Barry, both to be these sort of lab partners that offer these actionable sort of test outcomes, which is what we can play with. That's in our world. All right. Well, this was good. This was a good little quick touch on the course. Thank you, Jennifer, for your hard work on it.
Of course. Yeah. Thanks for having me.
Yeah, you really worked hard on this course. It's amazing. It's just right. I think it's just right. I love a course that gets to the meat of the issue and isn't overly bloated. That makes me happy. And I think coaches, you're really going to like it. You're going to feel like you know what you're doing in this realm, because the whole Wild West thing, on one hand, yeah, we don't have any regulations. On the other hand, it can be confusing to know what you can, can't, supposed to, aren't supposed to do. We just want you to know. We want you to feel empowered so you can help your clients feel that way too.
Absolutely. Confident in it.
That's right. Amazing. Okay. Well, thank you so much. I'm going to pop the webinar off, and we'll see you all very soon. Okay.
All right. Bye. Thanks for having me.
You bet.